Fasting promotes blood sugar control by reducing insulin resistance. Now, this just makes sense. Fasting promotes blood sugar control by reducing insulin resistance. When you fast, well, let me read this. Several studies have shown fasting may improve blood sugar control, which is especially useful for diabetics. In fact, one study in 10 people with type 2 diabetes showed short-term intermittent fasting significantly reduced their blood sugar levels. It just makes sense. That to me, that just makes sense. If you're fasting, one thing happens. First and foremost, the amount you're not eating. Now, this is if you're fasting from eating altogether. So if you're not eating and you're just drinking fluids, if you're not eating, the blood sugar levels tend to drop. Your cells will now start using the excess of sugar in the blood for its energy to be utilized, to burn, okay? To burn. So now that sugar is being burnt off, as well as you're burning off your glycogen stores in your liver. So not only are you lowering your blood sugar in your blood sugar levels, but you're also slowly but surely lowering your glycogen levels. Extremely important. Also, it's giving your insulin time to rest and your pancreas time to rest. Okay? Another thing that it does, a lot of times if you're diabetic, you have, I'll describe it as this, you have gunk on the keyhole. Okay? Now, the way insulin works is that it actually opens up, it's like a key to the lock to your cell to allow sugar to come in. Over years of having insulin resistance, you build up gunk, we're going to say that, gunk on the keyhole, where the key does not work as effectively. And it becomes more and more insulin resistance. And your blood sugar becomes more and more elevated, and you need more and more medicine and more insulin and things of that nature. Well, fasting does this. As it burns off the blood sugar, or burns off the amount of sugar in the blood and lowers your glycogen levels, it starts to clean the gunk off the keyhole. Okay? It starts to clean the gunk off the keyhole, allowing the insulin to work better. So now, as you fast, blood sugar levels come down, glycogen levels has come down, the body starts to burn more fat, and one of the areas that burning more fat off is off of the cellular walls that allows the key, the insulin, to work better, to open up the cell to allow the blood sugar to go in, or the sugar to go in, the glucose to go in. So fasting will help diabetics with becoming more insulin sensitive, not insulin resistant, more insulin sensitive, making their blood sugar much more stabilized. Now, if you're diabetic and you have a lot of issues with your blood sugar, you want to talk to your doctor or talk to your nutritionist about it, because sometimes fasting may drop the blood sugar a little too much, so you may need to start by fasting maybe 4 or 5 hours a day, and then you slowly but surely build it up to 6 hours, to 7 hours, to 8 hours, and things of that nature. But fasting can help you control your blood sugar levels much better, help reduce insulin resistance, and make you more insulin sensitive. Okay?